this morning we're going to demonstrate for you the priming of an IV line, checking of the fluids and the documentation around this procedure. So I've been to see Jemima Potter this morning and she is needing some IV fluids put up. The doctor has charted her some normal saline which we're going to go and check. Before I go into the treatment room, I'm going to give my hands a good social hand wash, and then I'm going to go into the treatment room and I'm going to need someone to check it with me. So as a student you will need a registered nurse to check this with you. Here I've got Jemima's medication chart, and on the back of the chart we will find the prescription order for the IV fluid. So first bag of fluid that she's having this morning is normal saline, 0.9%, 1 litre. So that's what we need to find. So here we have normal saline, 0.9%. The expiry date is April 2018. The bag is intact, there's no leaks, and the fluid is clear. We then need to find a giving set. We're going to use this one. It has a drop factor of 20, which we would need to know if we didn't have an IVAC to run it through. And we also need to check the expiry date down the bottom here. Okay. So now we need to run through the fluid through the IV tubing, and before I do that I'm going to give my hands a gel because I'm about to open equipment. So I need to open up this tubing first. Take it out of the bag. And I find the spike end and I find the end of the tubing. These are the two things that I keep in my hand so this doesn't drop on the floor while I'm actually priming the line. First of all, I turn the clamp down. When you turn the clamp down, the clamp shouldn't be able to freely go up and down the tubing. Next thing I do is take the blue cap off the IV fluid bag, just with a twist. And then I take the plastic off the spike end and using a clean no-touch technique I pierce it through the bag. I can then suspend the bag properly, and I'm now going to go to the IVAC and hang it. To prime the line, I start up this end of the tubing and I give it a good squeeze till I can get about the level to halfway. And then I slowly open the clamp to prime the line with the fluid. I'm going to hold it this way so that when the fluid gets to the elbow, it primes through the elbow here and there's no air at all in the tubing. And then I turn the clamp down again so it cannot roll up and down the tubing. I'm then going to move this blue clamp further up the line, and it just slides up the line because it needs to go through the gate of the IVAC. And we're going to run it through the IVAC. We turn it on. And we just follow through what it says on the IVAC. Press OK to mute and run on the battery. Press and hold the key. Speaker test. Do you hear the speaker sound? Yes, I did. It's a new patient. Press done to exit. It is a primary line. Now, the rate is mils an hour, and it's what's charted on the patient's IV chart. So it's 125 mils an hour, and the volume relates to how much is in the bag. So the rate's 125. The volume is what's in the bag. So this is a litre bag. We've primed the line, and there's approximately 20 mils in the tubing. So I'm going to enter 980 for the volume of what's left in the bag. Then we confirm primary. And then we need to go and finish our checks after we put this through the gate. So we open the gate. Now the tubing loads from the left hand to the right hand. It only goes in one way, so it goes in that way. And then you grab the tubing and pull it towards the back quite firmly. Okay. Now we need to take our prescription order and go across to the patient. Finish the checks over here. So as a student, you'll need your registered nurse to be with you to do all of this. She needs to be right on your shoulder while you're doing it. So the patient we've got here is Jemima Potter.
Yes, Jemima Potter.
Date of birth?
10th 1st 1934.
That's correct.
DCK001 NHI.
Good. And we've already checked that we've got the correct fluid, and it's the right time that we're giving the order. It's 10 o'clock. And your registered nurse is going to come along, and she is going to swab the end of the lure, and then she will plug that in. She'll open up the clamp, and then she will push start. As a student, you can only connect this up and push start when you are in your transition, so your last placement of the 3-year degree. Then we just need to complete our documentation. So we come back over here. So we need to complete the documentation on the prescription order. So we actually started it at 10 o'clock in the morning, so 1000 hours. I have checked it, and your RN will also need to sign. And then we also need to check that our signature is on the front of the medication chart. And then we also need to complete a fluid balance chart. So the fluid balance chart must have the patient's ID on it. We write the date here, which is the 21st of the 11th, 2017. Type of fluid we've got. It's going at 125 mils an hour. The first lot of 125 mils will be delivered to the patient by 11 o'clock. So once it is 11 o'clock, I will enter 125 in that space. The following hour, you will put it in the next space if it's delivered, etc., etc., through to the end of your shift. We also need to make sure that you can identify who is filling in the fluid balance chart. So you will need to put your signature on the shift that you're working, with your name and your designation. So you would write student nurse under designation. Then of course you need to make sure that you go back and check your patient. You need to make sure that they're passing urine, which you will record on this chart as well.